Good call, Isabel. All right. Hi, everyone. So I'm seeing a lot of familiar faces and names here. Welcome. All right, I will go ahead and pull up the slides here. All right. So welcome to our fall community update meeting. It's been a while since we've given an update, so we have a lot to share today, and we're excited to tell you about everything and to take your questions, and excited to have the team and some of the Renegade 50 here too. So we'll start off by introducing ourselves. So I'm Tess. I am the founder of Renegade Research and co-founder of Remission Biome. My background is actually in Earth and Planetary Science, and I have an undergrad degree in aerospace engineering. But I have had MECFS for 18 years now, actually 19. So I have spent a lot of time reading medical literature, trying to figure out my own case. And so it's led me to where I am now, sort of combining the research background and my personal experience. I'll pass it to Isabel.
Hi, everyone. I am Isabel. I am an MECFS patient of 43 years. By training, I am a systems engineer, and then I worked for a long time in the pharmaceutical sector. I then became a board-certified health coach in order to help other people with complex conditions to manage from a lifestyle perspective as much as possible, and done a lot of patient advocacy, and joined Remission Biome and then Renegade Research almost since the very beginning. And I'll pass it down to John.
Hi, I'm John Haughton. I'm the medical director, excuse me, for Renegade Research and Remission Biome. I too have an engineering background, electrical engineering, and approach the world in kind of a systems way, medically trained in geriatric rehab, and have been focusing lately on inflammation, long COVID, and MECFS. I was a patient with a cancer treatment as a kid that had radiation and chemo, and then had some long COVID that's now largely cleared up in the first wave in 2020.
All right, thank you. Okay, so I mentioned we have a lot to talk about today. We'll start off first by talking about how Renegade Research and Remission Biome are related, because we've gotten a lot of questions about that. Then we'll talk a little bit about the general Renegade research process, and then we'll give updates about Remission Biome as an example of one of the great Renegade research projects, but also probably the first thing that you know us for. Then we'll go into more details about Renegade's research itself as the organization and some of what we're working on now, in addition to Remission Biome, and what our plans are for the future. So, like I said, a lot of you probably know us from Remission Biome. So Remission Biome was a project that started in September of 2022. And it started by people talking about anecdotes of remission from taking antibiotics, remission of MECFS in particular. And so Remission Biome started just as this simple project. And then it grew very quickly into something much larger. By December of 2022, we had a GoFundMe that was quickly gaining momentum. In parallel, we started talking about something called Renegade Research. And so I had a actual dream about creating an institute called the Renegade Research Institute. And I started using the hashtag Renegade Research as we were talking about Remission Biome and talking about these ideas of patient-led projects. So the first part of Remission Biome was our pilot study in March of 2023. And then around the same time, people started using the hashtag #TheAcidTest. and the nicotine test on Twitter. And so these were kind of similar projects, patient-led, collaborative. The acid test was created by Naomi Harvey, Sierra Wright, Alice, and David Putrino helped, and Todd Davenport got the IRB. And there were some more people from our team, like Isabel and I participated in, where we helped to get the lactate monitors. And many of our Renegade 50 participants actually were first acid test participants. And so as we went on, in the summer of 2023, Remission Biome expanded to much more. We had a group of patients called a phase 1.5 participants, who are people who were prescribed amoxicillin antibiotics for an acute infection. And they did varying levels of the Remission Biome protocol. And then starting in August of 2023, we opened it up to something much larger, which you call the Renegade 50. And it's 50 participants going through the Remission Biome protocol. So kind of leading up to here, we have Remission Biome growing. We have this idea of this, similar model of patient-led projects. And so in December of 2023, our Remission Biome team collectively decided that we wanted to go for a community-driven governance organization. And so in December of 2023, we incorporated as a nonprofit. And it was important for us to have this collective decision making, because no one person has the right answer. So the box on the right side is then Renegade Research as more than an idea, more than a hashtag, but an actual organization. And so, like I said, we incorporated December of 2023. In March of 2024, we started putting on our Renegade Research roundtables. And then in April, we applied for tax exempt status with the IRS. And in September, we were granted that status. So we're now an official 501c3 organization. All right. So I talked about this model of Renegade Research that the different projects are using. And this was, started off with Remission Biome. And so kind of going through the cycle, we first sort of identify a problem, something that we're curious about, that maybe start off as a patient anecdote. We create a hypothesis and do a literature review, and then create a protocol to test the hypothesis. So by protocol, it includes interventions, but also different tests to do, thinking about the safety, thinking about the full plan of how the project will work. And we recruit participants, and then we do the protocol and measure its effectiveness. We analyze the data, we share the data, and then it either goes around to another cohort of that same project if we have additional questions, want to run through it again, or we can take what we learned and apply it to other Renegade Research projects, or sometimes it might initiate actual academic research projects, depending on what we find. All right, so I'll pass it off to John.
And then from a clinical or medical approach, the really trying to focus on the underlying systems of person, organs, cells, biochemistry within the cells. And so, and biasing towards speed to improvement. The goal here is to try to make people's lives better. So, we're not trying to say, let's try and do a study to take a brand new drug and get it into drug approval. It's saying what is out there that's existing? What do we know about? What are people learning that might work? And going from there to try and understand what's underneath it, and then turn that into a protocol. The shared learnings and public meetings, transparency is really critical, because none of us know any single answer, and sometimes doing the same thing that can be helpful at small amounts can be hurtful at larger amounts. And then keeping information flowing. And so the roundtables, there was one the other day on looking at brainstem and approaching it from all sorts of different directions, which was wonderful to tie together some of the biochemistry and anatomy and neurosurgery part of that. From specifics inside the activities, there's protocol development and review, there are case reviews. So people who might be part of one of the projects are, somebody has an unexpected side effect or something, or has a question, or what's going on with it. And sometimes it's logistics of getting access to, it might be a medication or a supplement that's easy to access in one country, but not in another country. And then there's provider communication. There are a few people right now where they've got an advocating local provider that doesn't have a ton of experience and activity around some of the condition, but is perfectly willing to order testing or order interventions that are safe and appropriate, and can judge that on his or her clinical evaluation. But we can say, hey, here's a systematic way to try something. And so that seems to be working really nicely to balance some of what the collective knowledge is with some of the specifics locally. And we can go to the next slide. So the clinical bias of improvement without decrement. And sometimes we all know about Herx reactions and other things. There might be an inflammatory release of something that's sequestered that's going to have a temporary downside before an upside, but really being very, very cognizant of how tenuous some in with the ME/CFS can be, especially with post-exertional malaise and just taking somebody outside of their energy envelope. So that is always front and center. The people who are participating in projects, it's critical to have local provider coordination and ongoing care. This isn't emergency treatment. It's not all the day-to-day care, but it's a coordination working together. And then understanding the base situation. We'll get into this in an example of the Remission Biome protocol in a minute, of the testing and understanding what is the base of where somebody is. And then once that's understood, it might be that there's some pre-protocol activities to bolster certain areas. Somebody is low on a vitamin, low on a mineral, that or inflammation is too high or something that needs to be quieted down or normalized before one would expect the intervention to have an effect. And then we apply that, and then really critically follow up and measure from quality of life, measure in terms of quantitative metrics that we can learn from and reproduce. And then I think I hand it off from here.
Yep, so now we're going to go into Remission Biome update. Next slide. All right, so we're going to give a general update in here. And as Tess alluded to in the beginning, the initial idea was to recreate the amoxiclav remissions that patients had as anecdotes. And we were able to accomplish that during the pilot and the 1.5, and also some in R50. So, but during the process of the R50, right, we found that the protocol could also increase baseline without a remission event being triggered. So, and also people get that even before the antibiotics phase is implemented. So it has evolved for that and other reasons that I'll talk in a moment to a much more individualized approach, especially at the front end. And we have a track with a choice of antibiotics and a track without it. Next slide. So these are the phases that we go through the protocol. So at the first onset, we thought that we were going to have people go through the protocol in a very similar fashion that we went through during the pilot, which was a few months. But we found that there were a very large portion of the cohort that needed much more stabilization. So we added additional stages, and this stage 1 in particular is designed to be far more individualized than just going through the protocol. So during that stage, the participants work with their providers, and there is a lot of testing for SIBO, there's testing for organic acids, there are CIRUS tests, there are microbiome testing, and there are a lot of testing that are done from the provider side that are aimed to see what are the potential blocks, what are the potential barriers, what things the participant needs to address and stabilize before going into the meat, if you will, of the protocol as it was in the past. So during that stage, the participant works on mast cell stabilization, good pacing techniques and understanding where that envelope may be, sleep issues, working with the wearables to see where that threshold is. And once we have that stabilization period accomplished, we know that co-infections, molds, it's not a prevalent issue. Then we have a small washout period where that participant does not do any more intervention. So the rest of the protocol is more similar in time frame to what we thought it would be in the beginning. So the stage 3, which used to be 1 previously in the protocol, goes into the gut-brain preparation, and it's preparing you with the hope of additional baseline increase in stabilization before going into the interventional antibiotic, if that's the track that the participant has chosen to do. And that's where we're looking at collecting the remission event data if a remission happens. So after the antibiotics, then we go back to reseeding the gut, rebalancing and stabilizing the system further, and then continue from there to stabilize the baseline of the participant and look at some more individualization once this phase is complete, that it's much more tailored to the participant itself. Next. Okay, so this is the current progress. We have had 9 participants who have gone through the protocol with the interventional antibiotics. And then we have 2 participants that are on track to be there in the next 3 months, and 6 more that are on track to be there on the next 6 months. Then we have about 8 participants that are moving along without major barriers through stage 1. We don't have a precise timeline, because then going through that stage and the results of that will determine that. We have 5 participants who are complex and proceeding, or more complex than the complexity of this illness that is complex already, and they are proceeding slow. Then there's very complex participants, there's 5 of them that are proceeding even slower, right? And then we have, and this kind of correspond with the severity that they're in. We have 1 participant that might not do any antibiotic intervention because or any other intervention at that point, because the baseline increase has been so significant. 1 that may not proceed for the same reasons, but that reason is unrelated to the protocol. And then we have 3 participants who are very complex and pursuing other options that may or may not proceed. We have 2 participants that we don't see that could proceed in the foreseeable future because of that severity. We have 3 participants that we don't know where that status is going to move to. There's some disengagement due to life circumstances. 3 participants that have dropped for different reasons, and then 2 who have not started but plan to. Next slide. Okay, and we're going to hear from some of the participants in the R50 themselves and give you a little bit of their experience during the protocol and the community in general. Ellie, do you want to go first?
Oh, okay. Let me get my camera on. Hi. Yes, I am a participant that started following on Twitter in about February, right before the acute of the three major players. And I started things on my own before I could apply. Applied and was accepted last summer. Actually, so delighted to get in and be with this community. The community is a source of strength and confidence and courage. I have 4 items that from just testing and tolerance testing that have given me baseline increases, and I probably wouldn't have thought of those items on my own. Their quality of life, quality of comfort, baseline increases, not necessarily can I go back to work yet, but that's not what I was looking for. Eventually, if I can try the antibiotic, maybe I'll get something that good. But I'm really, after 32 years of MECFS, quality of comfort and quality of functioning in my home and taking care of myself and doing self-care is what I was looking for. And I've already received that with plenty of ideas from this great community to keep trying. I think that's what I have to say. Lisa?
I don't think Lisa is in, so we can go to Kat.
All right. So I am Kat Boniface. I am technically a historian by training these days. Previously worked in animal sciences training. I worked for a vet for a while. So I try to bring a lot of that. I'm finding a lot of very interesting overlaps between some of the more common veterinary issues that we faced and what MECFS does to us. My primary trigger, as far as I know, was a pair of concussions, which were fairly severe. One of them knocked me out. And that certainly was sort of the point of no return. Like I can see looking back where, I was already developing those symptoms, but at that point they were not ignorable. I finally hit rock bottom in desperation about a year before I found Remission Biome. I wish I had found them earlier. But I had actually put together a protocol of my own that was fairly similar. Unfortunately, I have foster puppies that are very loud right now. That I actually had quite a lot of gains from. I had about 3 months of fairly normal functioning after that. And then I lost it, of course, as often happens due to some form of illness, some form of virus. And then I found Remission Biome. And initially I looked at it, I was like, okay, I see some overlaps. And the more I dug, the more I listened, the more overlaps there were. And I was like, okay, I've got to do this. And I had planned on waiting and going through the whole process and doing it right from the beginning. But then I ended up with a bad sinus infection, got prescribed amoxiclav. So I scrambled through. Tess very, very kindly sent me a box of supplies. So I was able to do about 3/4 of the protocol. And I had those remission events during it. It was really startling, even having watched the others go through, it was startling the changes. And I actually had about 7 months of, I wasn't back to full functioning, certainly, but of significant increase, that quality of life, that comfort, that not being in pain all the time. And then when we brought on the R50, we started getting more and more data, which has been fabulous. And of course, that community aspect. I really want to say that our participants being willing to share those nitty gritty details of every awful thing that happens to us. And even the symptoms that aren't awful. So we don't necessarily always mention them to our doctors because they seem unrelated or minor. And yet it turns out, when 30 or 40 of us have that same symptom, it matters. And we need to figure out why. And so more recently, because I've also been dealing with a lot of mold issues and a lot of candida, I haven't been able to go back through amoxiclav like I had planned this year. So instead, I've been trying to mimic the effects on some of the symptoms we're looking at and have had actually some fairly good gains from it. So we're hoping to find how we can find those different pathways, like was mentioned with the 6 stages of when do people need to go on a slightly different path just because of their own circumstances. Maybe they have more mold, maybe they have more brainstem issues, whatever it is. and trying to make sure that we still get that root problem solved while not making those issues worse. So I think that has been incredibly valuable for me, and I hope for others as well.
Thank you, Kat. All right, so one of the things that we discussed at the very beginning is the commitment for the protocol and everything we do at Renegade Research to be open source. So at the beginning, we had a website that had the list of the protocol supplements and so forth and so on. But what we've realized at that time is that people were picking and choosing certain parts of the protocol and the testing. And we didn't want to have something out there that wasn't systematic and that it wasn't properly done, right? Because that's when safety can become an issue. So we decided to take that down, work on seeing the data from R50 and releasing the protocol once we had enough confidence that we can write all of the details of everything that we have observed in order for people to really understand the depths of it. Because it's not just taking antibiotics, it's not just taking some probiotics, there is so much more to that. So we will have another public meeting. Our target is November, but definitely by the end of the year. So John our clinical director is going to do a presentation that is going to be aimed at clinicians understanding the protocol so they can work with patients, right, in implementing the protocol in a proper, efficient way so we can then have the results that we're all looking for, which is that baseline increase, right? And the rationales that go into, the different tweaks that might be made, the different tests that might be ordered based on individual results and so forth and so on. So looking really forward to that. So once it's released, it will have the list of the rationale for what it's used. But also common medications that the community takes, right, that may have interactions and what to look for. We will have a safety sheet for providers for amoxiclav, so they are aware of any potential issues. We know that correctly prescribed medications I think they're still holding at the third leading cause of death in the United States, right? So correctly prescribed at the right dose is the third leading cause of death. So we want to make sure that clinicians understand why, when, and how this protocol is appropriate for participants. And like we said in the beginning, there is a track without antibiotics. So also when that is a choice. We will incorporate that clinical education to get providers to feel confident in implementing it. And that way it can be expanded to the community. What we do have in R50 right now that will not be a component of is the one-on-one support. So we have one-on-one support for participants that guides the journey through the protocol. And the participants also have financial support from the funding that we have gotten because the ethos that we started with that we want to maintain is we do not want to have resources that only people who have financial resources can access. We want to make this open to the community. So in everything we do, we are committed to making that happen in that fashion so everyone has access. Next. Okay, so some of the analysis that we have been able to do up to date, we have preliminary results, and those will be presented at a roundtable on November 15th at 1 p.m. So stay tuned for that. The team is setting up a structure for shading data and creating analytic tools that can be shared across the projects under Renegade Research. And that will help us streamline future projects and cohorts as well. So we're analyzing more than just the amoxiclav related results. Something that is fascinating is the symptom clustering, for example. So we will have more information on this on November 15th. Next. Okay, so for the next cohort of Remission Biome, what do we need to get that going? We need to, before we can have a next cohort, we need to finalize our data pipeline. We're getting an online course set up so it is an easier process from the beginning that people can get answers and sort of like a self-paced process that can streamline the entire cohort needs. We need to get additional funding for that cohort. As I said, our ethos is not to have something that only a few people can access, but to have financial support for the community so everyone has the access to participate for the size of the cohort that we have the room for. We're looking, based on the data analysis, at additional protocol changes, right? So we may have a simplified protocol for people who are on the milder end of the spectrum, who already have MCAS under controls and that pass certain safety tests from the beginning. And we also may have a cohort with some more extensive testing so we can cross-analyze that data. And that, the results of that can help us have a more targeted and cost-effective protocol as well. Next.
All right,
Tess.
Renegade Research. Thank you, Isabel. A lot of information for everyone so far. So I will just mention that this is being recorded. It will be posted on YouTube. So if anyone, isn't able to stick around for the full time, you can watch it again later. Okay. So I mentioned in the beginning, Renegade Research as the organization. So, it started off as this dream I had, it became a hashtag, and now it's an official nonprofit organization with 501c3 tax-exempt status. And Renegade Research, the organization, is more than these research projects. It is more than Remission Biome. Remission Biome is one project under Renegade Research. And then we also are going to have projects in the clinical areas, awareness and education, and in the community. And we'll go through those in more detail so you can understand better. All right, so for research, Isabel mentioned, using our data analysis tools to study other projects. So one of the things that we want to do is, allow for rapid iteration of testing of interventions and setting up studies so that it doesn't take years for us to, run through them and get the results out to the community. And so we are already getting ideas for other research projects that we can do that will, feed from Remission Biome and feed into each other. So I'll go into more detail about these later, but just wanted to give you a few examples here of, these are similar to Remission Biome, patient-led, caregiver-led projects. And you'll see the nicotine test phase 2 on the bottom. I forgot to say that Troy Roach is the one that started the nicotine test, and he is he is involved with us now. That was a collaboration. So I just wanted to mention his name. For clinical projects, looking at open source resources for clinicians to use, the different protocols, list of supplements. And then for education and awareness, we're already doing these roundtables, the clinicians and the research roundtables, and creating a clinical education framework, which you'll hear more about later. And then for the community, Isabel mentioned that it's important for us that everybody can afford to, treatments from what we learn. So we will be working on like financial support for the research and care, and thinking about, like, in addition to financial accessibility, thinking about severity levels, geographic levels. So, all right. So our organization, Renegade Research, the 501c3 nonprofit. So we are the patient and caregiver-led organization. We are focused on ME/CFS, long COVID, and other infection-associated chronic illnesses. Our mission is to uncover scientific insights and improve overall quality of life for our global community. Isabel?
Okay, so what are we doing as an organizational snapshot? We are working on funding from grants and donations because that's how we are able to support the community and operate in general. We have a working board. And we also have a hybrid model that is between a flat and a traditional hierarchy because our leadership is very collective. Like we said in the beginning, the decision to have a nonprofit organization was done with community input. So we have regular meetings, we have regular discussions, and the community has a lot of input into everything that we do. And they are the leaders of a lot of the projects, and bringing ideas is just a very, very collaborative environment. We are all remote and global. We have our teams just spanned from so many different places. We are chronic illness members and allies. I don't think we've had the formal numbers, but is about 97% of the team is people with chronic illness. We have raised about $400,000 in cash plus in-kind donations. And we have a team of more than 30 volunteers that have put over 30,000 hours of donated time over the last 2 years. All right, next slide. Okay, so here, oh, it went down. There we go. So here are some of our people, right? And some of the people here, started with Remission Biome. And as part of the community-led efforts, have also become team members who volunteer, whether it is just on the Remission Biome project or Renegade Research as a whole. Next. We have some advisors and some very specific expertise that help us and guide us through the process. You guys I think everyone is familiar with Todd Davenport, David Estevan, Thomas Farley. Miguel is our clinician advisor for the European participants. And we have Sam Keaton, Joshua Leisk, and Rivka Salomon, who I think a lot of you also know because she's been a patient advocate for forever. Next. And then we have a network of speakers and collaborators as well. You have seen them on the round table. Some of them have done internal lectures for Remission Biome. And people that we can, call, have access to, ask questions, and just wonderful people who are looking to also help solve this puzzle. Next.
All right. So we wanted to thank our funders. Isabel mentioned that we've raised over $400,000. That started with the community crowdfunding, and we are now up to 595 donors. So thank you everybody who got this project started, who has donated to GoFundMe. We also got some grants through Balvi and Conroe, and then we've had some private donors reach out. In addition to all of this funding, we have gotten a lot of in-kind donations and discounts from companies that are involved in the protocol. So you can see the large list here. Very appreciative of how many of these companies have wanted to work with us. All right, and then the use of funds. So for 2023, this is primarily the GoFundMe and grants. You can see we spent most of it on the pilot and the phase 1.5 and the R50 financial support. So this was money going directly to pay for supplements, for testing, for the protocol, and then like I mentioned, going directly to some of the R50 participants for them to participate. So we only spent 10% of the funding on operations and 7% to pay some staff. And our 2024 financials will be shared next year, and then they'll be made available regularly. All right. So as an organization, we have been working a lot on figuring out how we can scale. So working on the structure of our team and organization, bringing in new people, working on the operations, communications, and fundraising. So we're at a point right now where we're really working on a lot of that so that we can bring a lot of our vision together over the next few months. Speaking of our vision, it is big. We have a lot of different projects that we're thinking about. In here, I'd mentioned the different parts of Renegade Research, so clinical research, awareness and education and community. Within those, everything in white here are projects that we have already started. They're varying levels of development. Some of them, we've just been running some very informal pilot trials on, or they're, we've set up partners, but Remission Biome Renegade 50 is our largest project right now. And then you can see there's a lot of other research projects that we have ideas for. For the clinical, we have been running the clinicians roundtables, but Isabel has an idea for a new type of roundtable where we can, once again, make connections between many different people. And then also creating the open source resources for clinicians and patients. For awareness and education, we've been doing these research and clinicians roundtables. We also are going to be working on a much larger clinical education project, which Isabel will tell you more about later. And then for the community, we really want to create resources for people in the community in collaboration with other organizations. And we want to create a global dictionary for medications and supplements so that everyone can have access to different treatments that might not be easily available. All right, I mentioned the upcoming research projects. So we have some really cool stuff coming up. And if you're interested in becoming a participant or helping out with these projects, please reach out. And we'll share later. You can go to our website and sign up for a wait list to be notified when we're accepting participants for these. But most of these, the projects start from like a patient anecdote, finding something interesting, and then we start to organize and figuring out, can we turn this into a real study? So we have a heart rate variability one using a polar chest strap. Currently running the anesthesia question, which Ellie is in charge of, who spoke earlier. If you are on Twitter, I'm sure you have heard of Kat's glutamate hypothesis. So we've been working on like an informal pilot of that, and we'll be turning it into something more, larger, more organized. Isabel has a special PEM formula that is anecdote working well for her, so we'll be testing that. We mentioned the second phase of the nicotine test. We'll be working with Troy on that. Looking at metabolism with a Lumen device, and many more. We have lots of ideas. Isabel?
Okay, so up to date, we have 14 roundtables recordings that are available on our YouTube. We are organizing more roundtables, and as Tess mentioned earlier, the idea of bringing the cases together and understanding how the researchers, the clinicians communicate and can inform each other, and how the patients can inform both, right? So we can look at the system as a whole and be able to break more ground a little bit faster with this education piece. Upcoming, we have November 1st, the part 2 of the mechanical basis roundtable. And like I said earlier, the Remission Biome Results Update Research Roundtable will be November 15th. Next. Okay, so we have been really excited to work on this clinical education project, which is a dedicated platform with clinician membership, where there is formal training and opportunity to network and have mentorship from experienced clinicians. We're starting our curriculum development with our medical director and other members of the Renegade Research team, and also in collaboration with Just Leis, who is, you guys, most of you guys know, with the Born Free protocol and his systems models. So the platform will be determined as to what's best suited. We're also working on a conference in Spanish and Portuguese in conjunction with Latin American low COVID and ME organizations that we're hoping to have in late January or towards February as well. Next. Okay, so on funding, we need additional funding to fund all of these projects, obviously, to have a continuous level of staff and fund operations as well. We have been working really hard on grant proposals. We were very limited before the 501c3, and that has been attained recently. So as you guys saw earlier, so that'll open up a lot more opportunities. We also have a new crowdfunding website, which is dedicated to nonprofits and takes care of the accounting on the donors' end. One very important piece here is that you guys can create a birthday fundraiser or a special occasion fundraiser and help us to continue to grow and bring these projects to fruition. So you can go to remissionbiome.org and /donate in order to do so. And please, share it with whoever you think, may be able to do so as well. Next.
All right. So before I go into this, I realized we didn't announce that if you have questions, go ahead and type them into the Q&A. So go ahead and do that while I'm talking, and then we'll open it up for some discussion with the people here and answer some questions. So how to get involved. We are always looking for new volunteers. We have the policy that people can contribute as much as they are able to, and there's no pressure to, if you have a crash, it's okay to step back. Isabel mentioned 97% of the people on our team have chronic illness, so we understand. So if you have, a special skill set, or if you really want to get involved, we're very happy to have you. So to fill out the application, you can go to remissionbiome.org/about/team. Donation, we already mentioned. Again, very helpful. The majority of our funding that we've gotten so far has already gone out to support the R50 community and to buy these tests and supplements for the Remission Biome project. You can submit ideas to us for research projects, for roundtables, and for problems you see in the community that you think we might be able to help with. So you can go to our website, Remission Biome, and use the contact form if you want to send those ideas. And then follow us. So we have a newsletter that we're going to be trying to send out monthly. You can, again, go to our website to sign up for the newsletter. We're also on Twitter at Renegade Res, and we have a YouTube channel where this will be posted, as well as you can find all of the past roundtables and other recordings. I think that is it. So I'm going to stop sharing.
I want to say something before we go into questions, just for that last slide. As we share, the differences and the relationship between Remission Biome and Renegade Research, we are doing, just like we did the launching of Remission Biome website and linking to all of that, we will be doing the same with Renegade Research. So right now, a lot of the information is contained in the Remission Biome website, but as we get everything more structured and off the ground, your place for everything will be Renegade Research.
Thank you. So as we're waiting for any questions to come in, I'm wondering if anybody on the team here wants to make any comments and, your experience with Remission Biome or Renegade Research, anything that we didn't cover in the presentation that you think people might want to know. Emmy?
Yeah, I just want to comment as a participant that I'm still in the first phase, and I didn't think it would take this long, but it just takes really long. Like just accessing the tests, accessing the medications that I might need to order from abroad. Once I needed to change my providers. Yeah, it just kind of adds up. So that's why for me it has taken so long. But it's as Isabel tells us, it's the goal is not to go through the protocol. The goal is to like have a baseline increase. So it for me it has taken like a lot of patience, but yeah, I think it will be worth it. Yeah, that's all.
Thank you.
Thank you,
Thank you
Amy.
for sharing. Maria?
Yeah, I too am at the beginning of the process, and with our complex chronic illnesses, it can all be so very overwhelming when one hears about MCAS, and then there's SIBO, and then there's, the brainstem. Could there be something mechanical? And just being part of a community of people who are sharing in this is emotionally really helpful, just, to begin with, and also makes it manageable to consider all of these possible factors and things to keep in check. And to me, it's been very valuable because I don't, well, in Mexico, there's no one who, gathers all of these things. I mean, we know there's the silos, and I love the breaking of the silos, right? That motto or so. But I don't see how I would have been able to consider navigating this if I weren't part of a community where all of these resources are shared and where we have leaders who understand sort of the big picture a lot more. So yeah, I didn't plan this comment beforehand, but just it's very valuable given how overwhelming our health issues are.
Thank you, Maria.
Thank you, Maria. Shelley?
Shelley?
Hello. There are a million amazing things that I could talk about what's going on at Renegade Research and the Remission Biome project. But I'm going to focus on one that I think is really misunderstood between the clinical medical world and the patient world, which is that we truly are the holders of the wisdom, along with our caregivers that take care of some of our more severe patients. And what this community has done is given us a vessel for the self-confidence and the legitimacy of being those wisdom holders. We are helping each other. There's not a single person that participates who isn't contributing and changing this world for everyone inside. And I'm super excited for us to release more of this to the community. The way that I engage, and I'm also a caregiver for my mom with Alzheimer's, with the medical community now is completely different because I know what I know. And I know how to go find out stuff, and I know how to go reference things. And so when I'm communicating about my own condition in the medical world or with researchers, I also participate in some other research, or I'm, communicating about my mom's care, I just come from a completely different place. And this is an empowerment movement that our patients desperately need. So many of us have been discounted. We hear these stories all the time. We fight for people who, need us to back them up in this case, but our confidence as a community is growing, and we are taking our place at the table to change this dynamic. And I'm really excited about the future of where this goes, and so many amazing people here. And that's just what I wanted to weigh in. There's so much more, but I really wanted to point that out. Thank you.
Thank you,
So
Shelley.
before we go to Sam and John, we brought Court up to ask a question. There you go.
Oh, you got muted
Now
again.
you're muted again.
Hey.
There you go.
Okay. Can you hear me? Okay.
Yeah.
Yeah. As I understand it, one of Renegade Research's and Remission Biome's main goals is to get information out on treatments as quickly as possible. It takes so long. Just getting a clinical trial underway is it's such a difficult undertaking. It rarely happens. And so I guess my question is, how do you intend to get the results out? Or will it be a series of reports? Is this, I guess, forming a clinicians network is part of that so that you can relay the reports to them? Do you intend to produce papers, journal paper articles? How can you get these things out as quickly as possible?
Can I jump
think
in
Thomas,
actually?
yes, absolutely.
Yeah, so we have, so I'm Thomas, I'm one of the, I'm working on the data team. We actually have 2 papers that are sort of in various stages of construction. One is writing up Jeff's mechanical basis paper, get that to publication at a peer-reviewed journal. And then we are just starting the process of writing up another sort of a mixed methods qualitative quantitative study with 5 of the people who had remission events as part of phase 1 and 1.5. That's a little bit earlier in the process, but again, we hope to submit that to a peer-reviewed journal sometime in the next, let's say, 4 to 6 months. So papers will not be like the only story, but we are definitely gunning for, high impact peer-reviewed papers in research journals. And we've got at least 2 ready to go.
Oh, good. I note that just as you were speaking, just how valuable just case reports can be, that doctors put in. So if you could, even small reports would be, if you can get them published, could be very helpful.
Yeah, I will defer to the MDs on that one. I'm a mathematician by training, so that's somebody else's expertise will be helpful there.
Okay,
Some
we
of them
have
come up. I was just going to say, some of them come up even in the, the round table. There may be a round table about a specific topic, and it ends up with nuance around it about different things that may have been tried around that topic. And so there's a lot of nuance with different folks with different expertise and different patients with different levels of severity. And so it allows to kind of get away from this works or doesn't work. Most of these things seem to work in a reasonable way at a reasonable dose with the right person. But it's who and when is critical.
Yeah,
Absolutely.
thank you. We have some questions in the Q&A. So the first one is just wondering whether some of your proposals and plans have significant overlap with what is being provided by other organizations. Would a cooperative approach perhaps be more efficient? And I'm so happy that this question was asked, because we are just hammering the cooperation and that approach in working with other organizations, right? So something that we say often is that we don't want to be duplicating work, because those of us doing the work are also limited by spoons. And the people who are not limited by spoons are limited by time, because there are so few out there in the trenches. So yes, we are discussing what other organizations are doing and having regular conversations. So what we're doing on our end is satisfied a particular need, and it's not overlapping with what other people and other organizations are doing as well. And then another question is, any parts of the Joshua Lee's Born Free protocol being added to the main Remission Biome protocol, or a separate project? So we have a couple of people that are testing that individually, and we will see from the data which parts are more helpful, right? And through our cooperative work with Josh as well. In the stage 1, which is where that individualization is needed, that's where those participants are implementing the Born Free protocol and seeing what are the different gains and needs, and how we can, for future cohorts, what needs to be integrated at that first phase that may streamline and perhaps standardize that phase a little bit more. All right. Who else had their? I think
Looks
Sam
like
had
Kim.
his.
Oh, yeah, Sam did first.
Yeah, he had the hand up before.
Sure. I just wanted to say a few words to emphasize just how exciting it is to have something in this interface of patient-led research that we can take advantage of crowdsourcing and citizen science alike, and democratizing the approach to progress. So just wanted to highlight that there's a bunch of structures that don't have as much awareness between DSci, which is short for decentralized science, and citizen science, which, as a published citizen scientist, I use the primary definition of research done without an institutional affiliation. And there's sort of the culminating factors of creating an institution to do citizen science sort of questions if we have a proper definition for it. But the fact that we have so much momentum and so much support and progress already in our short track record, I think is just something that I wanted to emphasize that has been mentioned, but I just wanted to put into a concrete focus that I'm really thankful for this group and being able to contribute as a research volunteer.
Thank you, Sam. We'll go to the next question before Kim. So Scott says, listening, communication, inclusiveness, access are very valuable characteristics of a research and advocacy organization. However, they are only valuable if research and treatments are correct and beneficial. What matters most to me is that Renegade Research vets every theory from beginning to end. Does this make sense with symptom set? Does this properly connect to trigger events? Will this address root cause? Will Renegade Research consider anecdotal reports, connect hypotheses to biological pathways, reports and available tests, and weed out what doesn't make sense in terms of the evidence and testimonies we already have, so that funds are used on the research with highest chance of success, rather than thoughtless new studies that have dragged out unproductive studies for so long? Absolutely. Again, love this question. One of the things that we have been discussing is, again, the so many silos, right, that exist. And we have research that is very helpful, but it doesn't necessarily lead somewhere, right? And if it does, it's going to be in such a long period of time. So in the cooperative environment that we work with, not only within the Renegade Research projects, but also with other organizations, is looking at how can we connect that. We have a dream of the ultimate research project where all of that collaboration is done, so we can have a cohort that has all of that analytic done within the same time frame, and that it's decentralized so everybody can participate. But in addition to that, the series that we were talking about earlier, the series for roundtables that brings in case studies, but also discusses what is that research that has already been done and that is emerging. What are the applications in the clinical setting? What are the clinicians seeing when they're trying these approaches, right? Based on the research that has been uncovered, so that can also continue to inform greater research and greater clinical application system-wide, right? Because one thing can inform the other. And so we don't have pieces of the research puzzle in all different places, but that we can bring it together to inform each other and to make faster movement into solving this problem.
And I think a part of that is the organization is really set up in an adaptive way. And so there may be a project like, say, Remission Biome, and it goes through phases and cycles that were talked about. But there may be adaptive pieces along the way of other things that are coming into play. I mean, frankly, even the question and answers. So we don't want to reinvent an educational program. So if there's a good one there, how do you cross-fertilize those? And many other examples on interventions. So and any ideas of how to make that happen are great. And with Tess and Isabel's leadership and really starting from a systems perspective, it's all about inputs and outputs and which parts are speed of change and which parts are speed of scale.
Thank you. All right, Kim.
Hi, my name is Kim. I hope my speaker isn't too loud. My background is 38 years in new business development and tech, mainly IT enterprise. And ironically, in 2019, I was working with a company in Toronto on the development of a pandemic tracking app when I became ill with COVID, early 2020. So I had some pretty interesting insights, had connected with quite a few epidemiologists, hematologists, etc. And then I met Isabel on Twitter, and prior to being involved with the community, I had no idea what my 75 symptoms were being caused by. It has been so insightful being involved with everyone here. I'm very emotional. I was diagnosed early last year with long COVID, IgG deficiency, and end-stage kidney disease. Before that, I was always very healthy and fit, so it came out of left field. And I have to say, I've learned in the last year about long COVID, PIM, MCAS, ME/CFS, inflammation, POTS. So many things I didn't realize were overlapping with long COVID. And now I have a much better understanding on how to explain it all in spoons. I didn't even know what that was. So at a very basic level, I'm now talking to a number of even people in the health community who are now down with long COVID, and they're wondering how I've managed to get through this. And I keep referring back to Renegade Research and Remission Biome. So I have to say I'm just very honored to be part of the team and to be assisting with fundraising and research. And it's one of the most amazing global teams I've ever worked with and had the opportunity to be part of. You all feel like family, and I feel as though I've found my tribe for the next leg of this journey. And I just love where Renegade Research is headed, and I'm really excited to be here. Thank you.
Thank you, Kim. We're very happy to have you. All right.
So I think Ellie had posted the chat. Ellie, do you want to talk about your
Sure.
comment?
In addition to being a participant in Remission Biome, I have been a volunteer with the project about the anesthesia and with the data team and with being a small group leader at times and a support group leader. But what I really want everyone to know is that they've built in to this organization, this movement, that we're all 97% gonna probably be sick or have symptoms or be in various stages of not feeling well or having a good day, plus all the stuff about life. And we try to cover for each other. We try to build in that it doesn't have to be a lot of hours, that if some person has one time with 1 hour, that they could do a little editing or make a few phone calls or look up some stuff on the web and put it into a document, that's valued and treasured greatly, because we know that it took spoons. So I think Anna wanted to add to what it's like to be a volunteer as well.
Thank you, Ellie. I started volunteering for Renegade in January, and I just adore this team. It's I never knew it was how important it was to work with people who also have the same conundrums in life and same challenge, because we, in like a regular job, at times it's so difficult to manage the expectations of people. But here I can say I'm crashing, I am not well, and everything knows what it's like. So I'm also super excited with the work that we are doing and what we are going and what we are building. So as part of the communications team and operations, I call in more people want to help us communicate the amazing work, because there is so much that you don't know, because we just don't have the capacity yet to put out there, to create content that can reach people at different levels of understanding and comprehension regarding healthcare, caregiving, research, anything. So we are applications for volunteering are open. So I'm just calling out and saying, if you have 1 hour here and there, it's always important. It's the compounding effect that becomes exponential. So thank you, and thank you for having me in the team.
Thank you, Anna. You know, there's no need to say how much we love having you in the team. So that reminds me of a phrase I haven't used in a while, but with the compounding and the exponential effect of working together, is that what we are looking to achieve is exponential decay of suffering, right? So as the work continues to grow, the suffering of this community goes down. We are all, whether it is from a patient perspective or a caregiver perspective or a provider perspective, those of us who are immersed in the trenches, no, I'm sorry, I'm getting a little bit emotional. We all know how much suffering happens, how you know, we watch as our capacity goes away, we watch as relationships disappear, we watch how hopes and dreams are either put on hold or not attained. And the biggest goal of this community is to have that move towards the decay way and not continue to grow as it has in the last 5 years. So we are an awesome team. I can say that with the utmost confidence. So if you want to join in any capacity, let us know. Tess.
And Rochelle just put the volunteer application link in the chat for everyone. Anything else from anybody? All right. Yeah, I don't see any more questions. Thank you, everybody, for coming. And hope to see you on November 1st for the second part of the mechanical basis roundtable, November 15th for the Remission Biome results meeting, sign up for our newsletter so you can get registration links for those. And what else?
Follow us wherever we
Follow
are.
us, yes.
And keep in touch. We love hearing from
Yes.
everybody, whether it's responding to a post or, reaching out. Just keep in touch. We love hearing from you.
And if you volunteer in, it doesn't mean you're committing to it from that point forward either. People come and go, and that's okay. There's at different times, it's all seasons and chapters, and there's a momentum growing that's just profound to be a part of.
Absolutely.
Thank you.
Thank you, everyone.
All right,
Bye-bye.
bye, everyone.